University's Clinical Skills video series. This particular video will show you how to insert and remove a hoist sling while the patient is seated. It demonstrates the fundamental principles, and therefore it is imperative that you additionally refer to local policy before carrying out this clinical skill in practice. This video has been filmed and edited by Claire Ford and Laura Park, with a special thanks to Gemma Bradley, Stephanie Whittington, Anne Hutchinson, Julie Tweedley and Julie Derbyshire. Before carrying out any moving and handling manoeuvre, it is essential to consider and undertake the following. A towel risk assessment. This is to ensure and ascertain the appropriate manoeuvre and equipment required to move the patient safely. To perform hand hygiene as required, to decontaminate equipment as necessary, to don and doff personal protective equipment appropriately, and to respect the patient's privacy and dignity. This video will first show you how to insert a sling while the patient is seated. First, communicate with your patient to ensure they have all the relevant information needed in order to provide informed consent. Please note that there are various types of slings, and therefore techniques will vary according to manufacturer's instructions. For the purpose of this video, a universal divided leg sling will be used. The sling should be compatible with the hoist and appropriate for the patient. For this, check that the attachments of the sling are compatible with the points of attachments to the hoist. The sling should also be the appropriate size for the patient's weight and height and their individual requirements. First, adjust the height of the bed so it is at appropriate height so the carers can insert the sling. It is important to note that a hoist sling can be inserted either from a starting position of a patient lying on their back in bed or sitting in a chair or a wheelchair. For this video, the sling will be inserted while the patient is in a seated position. While one carer prepares the sling, the other carer can prepare the patient to sit forward. To assist the patient to sit forward, the carer could either provide assistance from the front or from the side. Just remember to be aware of your own posture, and you should handle using an open palm technique. While the patient is sat forward, one carer should insert the sling and position it as far down to the base of the spine as possible. Then ask your patient to sit back. Next, the carer should ensure that the leg straps are passed under the thigh, ready to be hooked up to the spreader bar of the hoist. This may require the carer to encourage the patient to relieve weight from one leg to another. This can be done by leaning or being assisted to move from side to side. Remember to maintain patient dignity. Finally, check the leg pieces are not twisted or folded to ensure comfort and security. The sling is now inserted and ready to use. The next part of this video will show you how to remove the sling once you've hoisted the patient. The sling should always be removed at the earliest opportunity unless it has been specifically risk assessed to be left in situ. First, you must detach the sling from the spreader bar and move the hoist away from the patient. To remove the sling, you first need to remove each leg strap in turn from underneath the patient's legs. To do this, the carer should kneel in front of the patient to avoid top-heavy posture, and they should gently place the patient's foot onto their knee, giving them enough room to release the leg straps. It's good practice to do this one leg at a time by the same carer, to avoid the patient feel like they're being handled in different directions and to preserve dignity. Once the leg straps are free, the carer should roll the leg straps away from the patient's skin towards the back of the chair. The patient can then be asked to sit forward or assisted to sit forward from the back of the chair so the sling can be lifted out. Then ensure patient comfort and safety. Then decontaminate or dispose of the sling correctly if required. Then decontaminate your hands using the appropriate technique. Document the care fully, remembering to ensure you've included your signature, the date, time and designation. We hope you've enjoyed this video and that you'll watch some of the other videos that have been developed as part of the Northumbria University Clinical Skills video series. Thank you for watching.